Hi, my name is Professor Tim Mackey, and I will be presenting this e-poster for the SRNT 2021 Virtual Annual Meeting. We'll start off with some disclosures. I'm currently an associate professor at UC San Diego School of Medicine and also the CEO and co-founder of the big data and machine learning startup company, S3 Research, which is currently funded by the NIH through an SBIR contract. The company had no input, provided no funding, and had no role in this study. The title and subject of this presentation is Characterization of ENDS Industry Coordination and Influence on California Tobacco Control Policy on Facebook. This is a social media surveillance study. As background, California is one of the leading states on tobacco control policy. Facebook is also one of the world's largest platforms and can be used as a manner to engage in industry and grassroots mobilization, including activities for the ENDS industry. We sought to examine how the ENDS industry systematically coordinates to influence tobacco control legislation on the platform. The methodology included data collection using a web scraper to collect posts from Facebook from two specific Facebook public and community pages of two ENDS trade associations. They're listed here, CCASA and CSSFATA. Data included the post text, the URLs associated with, the numbers and content of comments, numbers of shares, and the number and type of emoji comments. In order to identify major themes of political mobilization, we manually annotated all posts collected using an inductive coding scheme in Atlas TI. This generated a codebook with parent codes and subthemes, with the corporate political strategies used by tobacco industry by Savell et al. As our overarching theoretical framework. We also measured engagement of users and their potential affiliations to the ENDS industry by analyzing metadata from users who had interactions on these pages. Additionally, our coding for engagement assessed if users expressed support or opposition to tobacco and ENDS policy-related posts, per the details here. In total, we collected 699 unique Facebook posts during the study period. 74.7% of these posts were directly related to tobacco control policy, indicating that these pages act as discussion forums and coordination points for political mobilization. The general categories of themes detected include event invitations to invite members to participate in anti-policy activities, public mobilization posts asking the public to take action against tobacco control policy, descriptive information about bills being proposed or enacted, and commentary on tobacco control policies and how they could negatively impact vapers and the ENDS industry. In some posts, multiple themes were generated, with public mobilization posts making up about 50% of the data set. Here are some de-identified example posts of what we detected. When analyzing user engagement through comments to approximately 2,300 Facebook posts that we looked at, unsurprisingly, the vast majority of users expressed positive sentiment and support in opposition to tobacco control policies, with very few disagreements. We also noticed that CSFATA had a higher average user engagement compared to the other page, which was CCASAA. Finally, based on self-reported metadata of users, 28 unique user accounts who posted and 53 users that interacted with these posts had affiliations with the ENDS or tobacco industry. These included employees of manufacturers, retail shop owners, online vendors, wholesalers, and trade associations. We're conducting additional research to identify network analysis features of these groups and their mobilization patterns. In conclusion, these preliminary results indicate that the popular SNS platform Facebook acts as a mobilization point against tobacco control policy. More research is needed to assess how these digital advocacy groups actually impact real-world enactment and implementation of tobacco control policy. And there are few, if any, conversations attempting to engage with these groups, including correcting potential misrepresentation of tobacco control efforts. Strategies to engage in these echo chambers is really needed in addition to counter-mobilization efforts that are public health focused. We want to thank the California TRDRP program for their help to fund the study and to all our research team members. A project study site will be created shortly with more data and information from this project. Please follow me on Twitter at TKMackey to be notified when site goes up. And thank you, and please enjoy the rest of your conference.